Good morning, all of you. This is Dr. Ruchi Shirudkar, founder and director, Pediatreat. Today, I'm going to share a small case of a child who's having 102, 103 fever, right? So, the child is 5 years old and he came with his parents. His father was carrying him. So, the moment he entered my cabin, he was like, "Mujhe bukhar hai, main bimar pad gaya hu, mujhe throat mein pain ho raha hai." And he was showing my hands कि मुझे यहाँ पे दर्द हो रहा है. I said, "Okay, और क्या है?" बस फीवर है. So मैंने पूछा क्या हो गया तो mother said that he's got high grade fever 102 103 when asked what ये आपको question हमेशा पूछना है कि what does the patient do, the child do during fever, what are the changes in the child during fever. So the mother said he complains of leg pain, तो पैर दुखते हैं during fever, and second was that he is very uneasy, right? रात को bed पे he was moving here and there, तो थोड़ा restless रहता है. I said, okay, any other change in during fever and why he got fever? So the answer was yes, सर गर्म रहता है, his head is hot and हाथ पैर ठंडे रहते हैं. ये भी आपको symptom बहुत ज़्यादा बच्चों में मिलता है जब parents बोलते हैं. And मे बी मुंह में उंगली डालता रहता है तो इन्फेक्शन हो गया होगा, हाथ बार बार बच्चे धोते नहीं हैं. तो दैट इज़ ऑल व्हाट मदर सेड. और ही एट अ लॉट ऑफ स्ट्रॉबेरीज इन लास्ट वीक, तो उससे हो गया है क्या. सो ये सब मम्मी बोल रही थी. बच्चा वॉज एकदम आराम से बात कर रहा था, फट से जवाब दे रहा था, एंड ही वॉज नॉर्मल. ही वॉज सिटिंग एंड देन लाइंग ऑन द examination table. जब चेक किया तो he has big enlarged tonsils, swollen red tonsils थे, right? So now how will we approach this case? So the first part is कि जैसे बच्चा आपके क्लिनिक में आता है वो क्या बोलता है कि नहीं बोलता, वो शाय है क्या है. So the first rubric that I took in this case was confident. The child was very very confident. एकदम आके आराम से बोला कि डॉक्टर मैं बीमार पड़ गया हूँ, मेरे को फीवर है. So we normally take timidity bashful in kids, but we sometimes forget to take this rubric which is called as confident. I use it very very oftenly in my clinic. So the first rubric that I took was this child was confident. Second, बच्चे को लग रहा है मैं बीमार हूँ. So delusion, sick being. Okay. Third, जो वो हाथ से दिखा रहा था कि देखो मेरा गला खराब हो गया है, मुझे यहाँ पे पेन है. So the third rubric that I took was communicative. Fourth, during fever, the child complains of leg pain. So leg pain, fever during. This is also a very important rubric. It has very limited medicines, like 6 medicines. So it will always narrow down your, set of medicines. And head hot with limbs cold. This all rubrics I took, and the remedy that came was spongia. So because he was having a high grade fever 102 103, I gave spongia 200 water dosage. What is water dosage? You take a glass of water and you put 10 drops or 5 drops of spongia 200, stir it every time and give it. So you can give it 3 times, 4 times, depend upon the severity of the fever. Alright? And next day जो spike हर 4 hours में आ रहा था वो सिर्फ 2 times आया. The fever also was 9900, and third day he was absolutely fine. So this was a case of spongia. 2 learnings I will tell you in this case. First, if the child is very confident, feels I am sick and has leg pains or restless, always think of spongia. A confident child who feels I am sick and who's you will always come to spongia, and it is a very important remedy during fevers. Also, we normally give it for cough at night and cardiac anxiety. It's also a very important medicine for cardiac anxiety. I have treated many cases. Second is always evaluate, like head hot, cold limbs with is not covered by spongia, but you take all the rubrics that are coming in the case. Always evaluate what is most important in this case. So for me, what was most important was that he feels that I am sick, he is very confident, and so first 3 rubrics, that I am sick, delusion, sick being, confident and communicative. If I club these 3 and leg pains, I also took restlessness during, like he was restless, he was uneasy, moving here and there on the bed. Okay, so this was a small case of spongia, and I hope my always intention is to tell you the exact rubric. If you don't know the core of the remedy, you should ideally, but if you don't know also, it's fine, because lots of acutes, they don't come up with core, कि भाई natural mule का core क्या है, spongia का core क्या है. No, if you select the exact rubric, you make a good analysis, you evaluate your totality, you will always and always come to the right remedy. So forming exact rubrics is the entry to your successful practice. I honestly feel that. I may know a lot of image about various drugs, but if I don't know to form in those 5 minutes to form an exact rubric, I may fail in various cases. So yeah, so study rubrics, you also study materia medica, but study rubrics. Try to form the exact rubric to every case, and especially pediatric cases, because in acutes you see only for 4-5 minutes, and in those 5 minutes you have to make your totality and give the medicine, right? And if we fail in acutes, we will not get a lot of cases. Okay, and today is the last day for registration of rubric 8 seminar, a webinar that I am taking. We are, as I have already told, that I am conducting a series of sessions on rubrics, how to form. We are covering from alphabet A to Z. So today, that is 22nd of Feb, is the last day. So do register, and yeah, we'll all learn together. Thank you all of you.